I thought these pictures were kind of interesting to see in terms of for people who've never done IVF to know exactly what's happening. So as the follicles are getting bigger, and when you looked at an ultrasound, a lot of the black content that you're seeing with that black circle is just water. So in that water, there's a microscopic egg. And so when we're doing egg retrieval, we're actually using transvaginal ultrasound, and we place a needle directly into the follicle. And we're trying to aspirate not only the fluid, but also the egg with it. The reason that HCG is given is not only to help with the maturation, but it's also to help release the egg from the sidewalls. So for example, even if the egg was very large and the follicle is very large, if someone doesn't take HCG and we just place a needle inside, what ends up happening is that you end up having no egg retrieved, and the reason is it didn't release from the sidewall. So this is how an egg retrieval is actually performed. We have an vaginal ultrasound that is normally used to view the ovaries. Under direct visualization, there's actually a guide here for the needle. And under direct visualization, we go into each follicle and aspirate the eggs. The eggs are then placed into the tube that's in a warmer that goes directly into the tube in a media that's passed off to the embryologist, who then, under the microscope, sees the egg, and these are the cumulus cells around it, granulocyte cells. And if there's any male factor involved, and the sperm is injected into the egg, this is what is happened. So a sperm, after the sperm wash, is actually chosen, a single sperm is chosen. It penetrates through the membrane wall and is inserted into the egg. And this is the development of a normal embryo. And so you see a mature oocyte where the first polar body has been released. And the way we determine fertilization the day after egg retrieval is to see that there's two polar bodies, one from the sperm, one from the egg. And ideally, on the third day, you'd like to see between 4 and 8 cells. And so this is an example of a good embryo where you can see all the cells are very equal together in size. There's minimal fragmentations. There's really no bubbles. We call the bubbles vacuoles. And this is an example of an embryo that is poorly developed. It's asymmetrical. There's a lot of fragmentations with the smaller cells. And so what happens between day 3 and day 5? So there's compaction, and so you can see that it's actually compressing together to re-expand on the 5th day, and this is a blastocyst. And what determines something to be a blastocyst is several factors. So it's to look whether or not there's this water-filled cavity called the blastocele, and you're looking for 2 things. One is this little clump of cells is called the inner cell mass that becomes the fetus. The outer cells is what's called the trophectoderm, and that becomes the placenta. And so whenever you're getting to the level of the blastocyst, you'll then get grading based on how expanded it is, and what the inner cell mass looks like, and what the trophectoderm looks like. This is a hatching blastocyst. And so I just wanted to show you some other things. So sometimes people are doing PGD, and when you do PGD, we're actually just biopsying 1 cell from the egg, from the embryo to test it. And now we're also offering a day 5 biopsy, so you're actually doing it at the blastocyst stage. And the benefit of that is when you're doing it on the 3rd day, it can really be like a mosaic pattern in a bathroom, where you're testing 1 cell, but it may not be reflective of all the other cells that are in the embryo. So now the movement is more towards a day 5 blastocyst biopsy. So you actually, when I showed you that hatching blastocyst, we actually biopsy the hatching blastocyst, and we test hundreds of cells so that it's more representative of the embryo. We have the donor oocyte again when it's about ovarian. So you can have a beautiful blastocyst, but there's really no correlation between whether or not the blastocyst is beautiful and if it's chromosomally normal. And it's the chromosomes of the embryo that will determine pregnancy. Gestational carriers is when you're using someone else to carry the pregnancy. And there's also fertility preservations. I deal with a lot of women who have breast cancer, and as soon as they're diagnosed, before they undergo chemoradiation, they preserve their eggs or embryos. So the conclusion for me here is that it's really about the individualization of the protocol, and that really helps with the success. And the goal always is to minimize risk and maximize success, obviously.
So fertility with Chinese medicine. What we want to do in the beginning, like Dr. Baek mentioned, it takes about 2 to 3 months for your eggs to grow. So this is the perfect time for you to prep. So what you want to do is optimize your egg and the sperm quality. So how do we do that in Chinese medicine? Acupuncture and herbs help to facilitate more blood flow to the area of where the egg is growing in the follicles, at the ovaries. So it's about bringing more blood flow and nutrients to the ovary and also to the uterus, because blood flow carries oxygen and nutrients, and it's creating that better environment for the egg to foster, to grow. It's hoping that it will actually have a better embryo and the body will be more receptive to that, and hopefully it will become pregnant. So it's all about really creating the energy, the better environment for the uterus and the ovaries. And of course, stress management we talked about, and sleep. Sleep is also really important, like what I just mentioned. And weight management is also really, really important. You don't want to be underweight, you don't really want to be overweight. Sometimes you need to have a little bit more belly fat, because you do need fat to get pregnant. If you're too skinny, you're going to have a harder time, okay? And sometimes if you're overweight, you actually have higher chances of miscarriages. And so you want to make sure that you're always maintaining your body weight. And lifestyle imbalances, what we talked about, and also nutrition. I cannot emphasize how important nutrition is. In 2007, they conducted a huge study, nurses study, on nutrition and how it affects fertility. And it showed that what you eat, what you put in your body really affects your fertility. And also not only fertility, but prior to that, your ovulation. It showed that certain foods actually help increase ovulation regularly, and certain foods that actually decrease ovulation. So you want to make sure what you eat is really important. So when you come to see your doctors, we're not just saying, oh, you should eat this, you should eat that. But of course, everybody's diet is very different. It's very individualized. But for the most part, for reproduction, you really want to eat, like we talked about, warming foods. And you want to stay away from, obviously, any drugs or chemical substances. You want to stay away from alcohol if you can, because it's considered a toxin in Chinese medicine. And also caffeine, it's a stimulant. And you want to eat nurturing foods. So it really depends on your body type. And that's something that you could discuss with your doctor about what type of foods that's good for your body to eat. So how does Chinese medicine in general work with IVF? So like I mentioned earlier, it helps to regulate hormonal balance. So what happens is, if your FSH is too high, when you go into stimulation, you're probably not going to respond too well. So what happens is, we get a lot of patients actually coming to our office from the doctor's office, coming in to say, all right, we got to work on your FSH or help balance your hormones. And because acupuncture does work on your HPO axis, that's the reason why it can help with the FSH and the estrogen balance. And also help improve blood flow to the uterus, hoping for a better improved implantation. There's a study done by Steiner Victoria in 1996. It's one of the very first studies conducted, and it showed actually after 8 treatments of acupuncture and actually electroacupuncture, it actually helps bring more blood flow to the uterus, which causes a better implantation rate. And also better ovarian response, and help reduce stress and side effects from a lot of medications sometimes you take. We do see a lot of patients who get a lot of bloating, or they feel sick, hot flashes, night sweats. And the reason actually sometimes you do get these symptoms, if you translate it into Chinese medical terms, is the medication that you're taking, it's very young. The gonadotropins are what's called the yang energy, what we talked about, right? The yang energy, because it's trying to get more eggs, we got to recruit, which is great. But sometimes the yang actually burns the yin a little bit. And that's why sometimes patients love it. If they're yang deficient, they actually feel really good on the medication. I'm like, do you have any fatigue? And I said, no, I feel great. I'm like, really? Yeah, I feel great. I'm like, oh, good. And then some patients, they come in and just like, oh, I'm having hot flashes, I feel terrible, I feel nausea, because sometimes it's a little bit young and their body sometimes can't handle it. so it depletes their yin, and that's why you get all these symptoms of almost like menopausal symptoms, like hot flashes, night sweats, and bloating. And sometimes actually having a little bit of bloating and all these is actually good for you, because you don't want to try to get rid of all the bloating completely, because because the drugs there are for a reason. It's meant to do its job. So you have to make sure, obviously, you go to the right acupuncturist for them to know how to adjust your herbs accordingly. And it also helps with actually the hyperstimulation sometimes from the drugs sometimes.